Hello, everyone. You're welcome to another session of A Day with your fertility specialist. I'll be your anchor for today, and my name is Precious Adama. Thank you so much for joining us. Thank you for tuning in, your likes, your comments. We really, really appreciate. On today's episode, we're going to be talking about beyond pregnancy. What defines success in fertility care? Most times, when we hear the words fertility success, what comes to mind is the two lines on the pregnancy test strip, but actually goes beyond that. Much like every other journey, it entails the testing of the pregnancy, the delivery, carrying the pregnancy to term in a healthy state. So today we're going to discuss all of that, what the journey entails. And to elaborate more on this topic, we have with us Dr. Debbie. Good afternoon, ma.
Good afternoon,
A
Precious.
pleasure to have you today.
Same here. Thank you so
So,
much for having me.
thank you, ma'am. So, for the purpose of those joining us for the first time, Dr. Debbie, she's the head of our IVF team here at Alps Hospital. She's a fertility expert, and she's going to be answering all our questions today. So, make sure you bombard her with anything you have to ask. Thank you. So, Dr. Debbie, over to you. When people think about fertility treatment, many assume success simply means getting a positive pregnancy test. Is that how fertility specialists define success today?
Thank you very much, Precious. And let me say, welcome, viewers. We're always happy, that you're out there, joining us. Yes. So for defining success, yes, the two things, like you said, on this trip is very important because that's the
Yes.
beginning. So, like you rightly said, it's a journey.
Yes.
Yes. A positive pregnancy test is an important landmark. But beyond that, what we aim for is to have a healthy baby and a healthy mother at the end of the journey. So
Yes.
it goes beyond, we see a lot of clients very excited, with a positive pregnancy. We are excited
Yes.
too, but we also look beyond that, to how the pregnancy will progress, and then
Yes.
at the end, having a life delivery of a healthy baby, and the mother also being healthy at the end.
All right. Okay. So, how has the definition of success in fertility care evolved over the years?
Yeah, so I think success in fertility care, the definition has broadened now. Before, in the early days of IVF, the excitement was with having a positive pregnancy test.
Yes.
So anything you could do to get that, which sometimes involves, transferring a lot of embryos, was done. But with the outcome over the years, with the outcomes we've seen, now the definition has broadened to how many of these women go on to have a live delivery of a healthy baby, and how is the mother at the end of the journey, how is the father at the end of the journey. So it has broadened to encompass all that. So we're not just excited by a positive pregnancy test, we're more excited when we have a live birth, a healthy baby, and a healthy mother, in general, a healthy family at the end of the process. Yes, so it has broadened. It's not just a positive pregnancy test. How the pregnancy progresses,
Yes,
the woman having a successful delivery, being healthy, the baby being healthy.
Okay. All right. Thank you. So, is there a difference between clinical success and patient-defined success?
Definitely, because every patient comes to the table with their expectations.
Yes.
Their what they're aiming for is different. Yes, all of them I want to be pregnant, but the way in which they want the pregnancy or what they want might be different. A client might come to you, they want to be pregnant, and what they define as success is having maybe a female child at the end of the day.
Okay.
That kind of couple might have had other children that were males, and now they want to have a female. Yes. So what they define as success is different. So it's not just clinical success. When you're talking of, the holistic care of this client, now you're looking at their emotional well-being, you're looking at their needs being met, you're looking at them being comfortable with the decisions that are being made. So the decision is not just going to be made by the doctor, it will be shared decision making. You give them all the information, they too, give their inputs and so on. So a lot is involved. It's not just a pregnancy test being positive.
Okay, thank you. So, is it possible to say we have a successful fertility journey if the outcome isn't like a positive pregnancy test if pregnancy doesn't occur at the end?
Well, it might be difficult to say it's a successful, fertility journey if there's not a positive pregnancy test at the end. But sometimes there are negative pregnancy tests, but the patient is satisfied that they were treated right, the right
Okay.
decisions were made, the right things were done, but pregnancy still didn't happen. So
Okay.
at the end you have a negative test, but you have a satisfied patient. To us,
Yes.
that is some measure of success. Yes, we would want a positive pregnancy test, but sometimes that positive pregnancy test doesn't always happen at the first attempt. But
Yes.
having a client that is satisfied that, oh, this doctor, this team has done the best for me, all
Yes.
the decisions, all the things that were done were in my best interest,
Yes.
but pregnancy didn't happen. That is something for us to having our patients satisfied at the end of the day, no matter the outcome, whether a positive pregnancy test or a negative pregnancy test.
Okay. Okay. So why should fertility treatments focus on healthy pregnancies rather than just the pregnancy alone?
Very, very important. What is it? What is having a, I don't know, having a positive pregnancy test and at the end of the day you don't have a healthy baby to show for it? Yeah, there might be like joy that it's cut short in there. That's like joy cut short. So the well-being, the end point now is a life birth, a healthy baby at the end, a healthy mother at the end, a healthy
Yes.
family at
Yes.
the end. Not that you have a child and the family is disjointed, or the husband and wife are no longer together because of certain decisions that were made in the course of treatment. So
Okay.
beyond a positive pregnancy test, we look beyond that to a live birth, a healthy baby, and a healthy mother. So that is more important to us. That at the end of the day, the mother is still, her well-being is intact. She's
Yes.
emotionally okay. She's physically okay, and the baby too is okay.
Okay. All right. Thank you. So, why is individualized treatment so important in achieving better outcomes for both the mother and the baby?
Yes, because no two human beings are the same,
Yeah.
one. And
Okay.
no, everybody has different issues. People have different underlying medical conditions. People have different reasons being the cause of their infertility. People have different ages. You know that age is a very high determinant in fertility care. People have different ages. They have different issues. So you can't box everybody into one
Corner.
box. Yes,
Okay.
into one corner. Yes. So you must address them as the individuals they are, because all these findings, when you do the evaluations, you do the test, the results you get would determine what you do for this client. And since people don't have everything the same, so you want to address them as individuals. It's very important. And then people have individual preferences, they have their individual values. What might fly with one person might not fly with the other person.
Yes,
They have
definitely.
different circumstances. Some people are constrained for time, some people don't live in the country, so you have to accommodate all this information to
Mhm.
bring up an individualized plan, treatment plan for that individual. So that's why
Okay.
individualizing treatment is very important.
Okay. Okay. So, how do fertility specialists balance achieving pregnancy with ensuring patient safety?
Very, very important. Like in our center, we have
Mm.
a limited, we don't go above a certain number when we're doing embryo transfer, because we're
Okay.
trying to guarantee patient safety. I told you that in the earlier days, a lot of higher order embryo transfers. You could have 4 embryos, 5 embryos, 6 embryos transferred,
Okay.
all in a bid to have a positive pregnancy test. But what is the safety like for the client carrying the pregnancy? Because the
Okay.
more the higher order of the pregnancy, when you're having twins, triplets, quadruplets, quintuplets, the higher the risk to the mother and even to the baby.
Okay.
Yes, the higher the order of the pregnancy, the higher the risk. The pregnancy becomes a high risk pregnancy, because the safest pregnancy is a singleton, one baby.
Okay.
So when you have multiple pregnancy, this woman is predisposed to having pregnancy induced hypertension, preeclampsia, a lot of medical issues, gestational diabetes,
Wow.
complications, which is the risk of having an cesarean delivery is more, postpartum hemorrhage is more, the baby too, risk of preterm delivery, low birth weight, having higher admissions to neonatal care, having
Okay.
issues with lung,
Wow.
yeah, because
That's
they're
a
born
lot.
at an early age, the lungs are not matured, so
Yes.
it involves a lot of risk both to the mother and the baby. So to
Okay.
guarantee that, we go with a minimal number of embryos, so that even if all the embryos will transfer implants, this pregnancy is still safe for the woman. So in our
Okay.
facility, we don't go beyond 3 embryos, and and then we still individualize. There's some patients that have just a single embryo transferred. There are some
Okay.
patients that have just two embryos transferred. So we look at the medical history of the client, look at all the underlying issues she has, her age, and all that to decide a safe number of embryos to transfer. Yes, we want
Okay.
pregnancy to succeed, but
Yes,
beyond that, we
definitely.
want a safe pregnancy outcome for the mother and the baby.
All right.
Yeah.
Thank you. So, is there like let me say, an age or a age range
Yes.
that this multiple pregnancy does not pose as a risk to the mother?
No, there's no age range for
Okay.
any age because multiple pregnancy takes a lot of demand on the
Body.
woman's individual physiology. So there's a
Okay.
lot of demand. Pregnancy is a highly demanding, state. And then when you're having more than one baby, the uterus is over distended, our cardiovascular system has to give more, all the system, yes. So there's no age that multiple pregnancy is safe. It's still a high risk pregnancy, no
Okay.
matter the age. It's just that in women that are more advanced in age, it poses poses more threat, more
Okay.
risk to them. Yes,
Okay.
but it's a high risk pregnancy
Oh,
in any age group.
all right. Okay. So, many people celebrate twin pregnancies after IVF. From a medical perspective, why is a healthy singleton pregnancy often considered the safest outcome? Okay, I feel like you just
Yeah, so
gave an
that
answer
the
to
more the
that.
babies, the more the risk. All those
Yes,
things we talked about, risk of the
yes,
woman having preeclampsia, gestational diabetes,
yes,
risk of having intervention, CS, bleeding after delivery, and the
yes.
risk to the baby. The more the number of babies, the higher the chance that these babies will be born before term. They'll be born preterm.
Okay.
Their weights will be some small weight, low birth weight. Challenges with prematurity, low birth weight. They will need intensive neonatal care,
Oh, wow.
admissions in the hospital for some time. They could have issues with their lungs because the lungs are not fully developed at that
Yes.
stage. So many things. Yeah. So
Okay.
singleton pregnancy
It's the
any day
safest.
is the
The
safest.
safest.
Yes.
Okay, thank you. So, how important is embryo quality, uterine health, and overall maternal health in determining treatment success?
Very, very important. Very, very
Okay.
important because the embryo quality will determine if this is an embryo that's compatible with life, is this an embryo that can continue to develop and can reach full term, or so if the embryo quality is in doubt, is jeopardized, the chances of miscarriages is high. Chances
Okay.
of this pregnancy not continuing is very high. And then uterine health is very important too because that's where the baby is housed. So if there are issues with the endometrium, that could also predispose the woman to having even pregnancy not happening
Oh,
in the
wow.
first place, or even having miscarriages. And if the
Yes.
uterus, she has issues in the uterus, maybe fibroids in abnormal locations, adenomyosis, so all those predispose her to having miscarriages. Yeah, so
Okay.
uterine health very, very
Very
important in a
important.
pregnancy continuing.
Okay. So, what can couples do before and during treatment to improve the chances of a healthy pregnancy?
Yeah, so they like we said, when they see their physician, preconception health, maintaining a healthy lifestyle. If there are deleterious habits like smoking, excessive drinking, they need to stop that. If the
Okay.
woman is overweight, even the man, they need to cut down on their weight.
Even the man?
Yes, even the
Okay.
man. Obesity affects everybody. So it's
Okay.
not just the woman. Though the woman, in fertility care, the woman is affected more
Yeah.
because there are a lot of factors, more factors in her that relates to the reproductive system as opposed to the man. But for
Okay.
everybody should be within their optimal weight. That
Okay.
helps, yeah, because when you're obese, not only your reproductive health is impaired, it affects your cardiovascular health, puts you at
Yes,
risk of a
that's
lot of
true.
medical issues, osteoarthritis, diabetes,
Yes.
hypertension, and so on. So they should optimize their health, ensure a healthy lifestyle, eating healthy, a lot of fruits, vegetables. And then if they have chronic medical issues, those conditions needs to be controlled. If you have high blood pressure, it needs to be controlled. And then with drugs that are safe in pregnancy, or drugs that don't impact on either the sperm or
Okay.
affect conception happening. Yes,
Okay.
so any medical issues, diabetes, all that has to be controlled before you talk about conception and fertility, getting pregnant and so on. And then you see
Okay.
your fertility specialist so that whatever else, investigations are done, so that if anything else needs to be worked on, all that is worked on. And your health generally is optimized even before you go into trying to achieve
Okay.
pregnancy.
So all these things you just mentioned, like high blood pressure, diabetes, it
Yeah.
actually affects pregnancy journey of
Yes,
a woman.
definitely. They affect the
Yes.
pregnancy journey.
Okay.
They pose a risk to the woman and even to the baby.
Okay.
Baby developing properly. Yes, high blood pressure can lead to miscarriage, intrauterine growth restriction. The baby doesn't grow as the baby should grow,
Okay.
and could even lead to intrauterine fetal death if it's not properly
Wow.
controlled. The
That's
woman
serious.
could start convulsing, can pose a lot of complications. So it really needs to be controlled.
Okay. Okay. How important is communication between patients and their team during the journey?
Very, very important. Communication is very important. I know, like we said, the communication is should be two-way. You communicating with the client and
The
the
client
client
communicating back.
communicating, you getting feedback to make sure that the client understands all you've been communicating. So communication
Yes.
is very important at every step. The client needs to be educated, needs to be enlightened. You let them know at every stage what is happening so that they can be part of it. And then you also manage their expectations. You tell them the risk of this succeeding, the risk of this, these are the options we have, this is what we advise, the chances of success with this, it's very important we communicate all that,
Okay.
to the clients, communicate that IVF is not 100% guaranteed.
Yes. Yes.
And it's
Definitely.
very important. Communication, you can't overemphasize it. Very, very important. And the
Okay.
communication should be throughout the journey. Even after an embryo transfer, you still need to keep communicating,
Yes. Yes.
what
Checking
is
up.
safe to do at this time, what they shouldn't be doing, and so on.
Okay. How is modern reproductive medicine continuing to improve both pregnancy rates and pregnancy outcomes?
Yeah, so modern medicine has really done a lot in improving pregnancy rates and pregnancy outcomes. We have
Okay.
all these fertility options now,
Yes.
reproductive techniques that can be tried for people that are not able to conceive spontaneously. We have advanced testing, different ways we can test to know what the issues are, what the
Okay.
problems are, and even in management and treatments, a lot of things that science has brought up now to manage. Even babies, sometimes you can't run away from the multiple births. So sometimes when these babies are born before time, we have facilities to manage them, manage
Okay.
the issues that preterm babies present with, and so on. So modern medicine has really done a
A
lot.
lot.
Yeah.
you know.
Babies that won't survive before, you see them surviving now. Babies born at 25 weeks, 26 weeks, you see them surviving now. Yeah.
Wow.
All thanks to modern medicine.
That's very good. So, how do you balance honesty with optimism when discussing difficult prognosis with your patients?
Okay, yeah. So, yeah, you can share the truth. Yeah, the truth might not always be palatable, but you can
Yes.
share it with optimism. You don't bring up an environment of doom, 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 to your clients. Yes, you tell them the truth as it is. These are the facts that we have on ground, but these are what we can do. Yes, so
Okay.
that they make objective decisions. You don't deceive them, you know,
Yes, and give
you
them false hope for
false
rest
hope.
of
Exactly.
things.
You tell them how it is, but these are what we can do. Yes, you could still try, but the chances of success at this age using your own eggs are a bit low.
Okay.
This is what we think you should do. This is what gives you a higher chance of success. It's still not 100%, but if you want to still try, you're allowed to try. You tell them everything, and then they make their informed choice.
Okay. All right. So, how do you encourage patients to prioritize their health rather than becoming consumed with the outcome of having pregnancy?
Yeah, it's so difficult. You know that this clients that it's not easy to wait, and clients have been waiting, for the fruit of the womb to conceive. There are a lot of them are consumed with just that. But we
Yes.
let them know that them improving their health helps to improve outcome. If you are overly anxious, if you are depressed, that won't help the outcome. So we let them know that it's important that you take care of yourself. It's you that is going to carry
The
this baby,
pregnancy.
and
Yes.
the better your well-being, the better your own health in terms of your emotions and even physical health, the higher it improves our chances of achieving success. So we just counsel them, and talk to them.
Okay.
Yeah.
So, have you ever had patients that were like adamant? Like you said, multiple pregnancies, it
Yes.
poses a risk, but you have a patient like, yes, this is what I want to do. And
Yeah,
you
yeah, yeah.
diagnose that, like, you
That's why
can't
they
do
are
this.
patient, and that's why you are their doctor, you are the expert. Yeah,
Yes.
so you balance it out. You see clients saying, oh, You see clients that maybe you tell them, oh, madam, you have 6 embryos for transfer. They say, tell you put all. But you are the expert, so you let them know, no, we
That
can't
no,
put
this
all.
is
Yes, even
risky.
though we can't guarantee that if we put two or we put one, it will implant and become a pregnancy. But we also can't take that risk of
Yes.
putting the six, because in case the six stays, this is not a pregnancy that is going to be safe for you. So
Okay.
we are the specialists and the experts. So we counsel them and balance it out for
Okay.
them and let them know, yes, we want you to succeed. We want this success more than you two in a way,
Yes,
but the
definitely.
outcome is what matters. The
Yes.
outcome, you carrying this pregnancy,
To
you
term.
being
Yes.
alive to take care of these babies, that is what matters. So we counsel them in that light, and a lot of them are open to the counsel we give them. Yeah.
Okay, that's good. So, what gives you the greatest confidence about the future of fertility care?
Yeah, so what is it? Because a lot of research keeps going on, so a lot of new things are coming up. A lot of new things are coming up. So research, human beings, we're dynamic people. We're not dynamic beings. So a lot of research, a lot of new things, new drugs, better advances in even the procedures themselves.
Yes.
Yeah, so that gives me a lot of hope about fertility care, that it will continue to improve and improve.
Okay. Thank you. So, if every couple watching today could take away one message about fertility success, what would you want them to remember?
Yeah, so I wanted to remember that they should be open to the counsel that doctors give them. Beyond the positive pregnancy, we want you to take your baby home.
Yes.
That is the most important thing. Yes, so be open to the counsel you're giving. And then another thing, your friends will not always tell you the truth, and then know that your journey is different from that person's journey, and your
Yes.
treatment cannot be exactly the same as another person, because you have different issues. So be open to what the counsel your doctors give you. Don't always
Okay.
rely on my friend said this or my friend did this. Just be
Yes.
open to the counsel, because you'll be counseled within your own issues, your results, what we get from your history, and what we get from the test. So just be
Yes.
open to the counsel.
Yes. Okay. Thank you so much, Dr. Debbie. I think that brings us to the end of today's session. Thank you so much for being with
Thank you
us.
for
Thank
having
you
me,
for your
Precious.
insightful answers to all our questions. And thank you to all our viewers for sticking around till the end. We really, really appreciate. I hope you learned a lot because I definitely did. So don't forget to join us on our next sessions. We usually do this every Fridays and Wednesdays. As you know, 3 p.m. remains the time. You can join us on Instagram, on Facebook, on TikTok. So thank you so much and have a lovely day ahead.